Okay, so this is the NHA exam review, November 10th, 2020 for Careers Unlimited. All right, so let's start off with the basics of the review. First of all, whenever you present yourself, and this is something we learned in CNA, whenever you present yourself to a patient, you have to give them your name, your title, and why you are there. You have to get consent first above everything else, okay? You don't have that consent, you cannot move on further. So make sure that when you are approaching someone, do it in a friendly manner, okay? Of course, remain with your distance and use all precautions, all the PPE that is required, okay? So if you're not familiar yet with the PPE or you're just not sure, refresh yourself with that, guys, on the appropriate PPE to wear. Okay, so make sure that you provide your name, the title, and exactly why you are there. All right. Verification is very important. Once they give the okay, you need to verify who they are. All right. Ask patient to state their name, date of birth, and if possible, guys, have them spell their last name out to you. Okay. We have a lot of, last names that are very familiar in our area. They sound the same. They even look the same. So make sure that you do have the correct patient in front of you. And that way there is no mislabeling of any sort, or that can come later, guys, when it comes to getting the wrong patient with the wrong tube. Okay. It can affect the resident down the line and possibly hurt that resident or patient. So make sure that you have the correct person in front of you, and check also their identification bracelet. Those are three things I think that are extremely important when you are verifying the person, okay? Their response must match the information on the registry or generated specimen label, okay? Patient's response must match the requisition form, and the requisition form basically states the patient's name, date of birth, possibly, their social security information, the tubes that need to be, withdrawn from them for blood, as well as other important information. Make sure that the information you have at hand of the patient, that it is kept private. That is part of the HIPAA violation, guys. You need to make sure that all your material is secure. If you are using a screen, a computer screen, and you're not using an actual paper, make sure that you are the only one that is seeing that screen and nobody else. Not even people who are in there with the patient can see what you see. So make sure that the information that is visible to you is not visible with people around you. All right, so please make sure of that, guys. The ID band and bracelet or armband or wristband, guys, must match the name with the hospital ID number, which is also called the MR number. Sometimes the bracelet will not be on the wrist, okay, depending on their situation. So look at their leg. It could possibly be on their ankle. Now, when it comes to the verification, if the verification bracelet is on the bed, all right, and usually in the back of the bed, you have the bed that comes forward and back, and there are ways where you can put the verification bracelet there. If it is there, that is not part of the verification, okay? You don't know if that bracelet belonged to the resident who was there before. So make sure that that bracelet is on the patient for verification. If it is on the bed, if it's on the side table, all right, it is not valid. Even if it's connected to the IV lines or the machine, guys, that is not valid. It must be on the patient, all right? What we call that is the three-way ID, guys. You must get first verbal ID, okay? So have them state their name, date of birth, and preferably spell out their name. The ID band is a second verification, and the labeling specimen with patient's ID band, that is the three-way ID, and that is extremely important, guys, when it comes to that. I believe there was a question, and it's been a while, guys, that I took the exam, but I believe that was a question that focused on that. So please know the three-way ID, okay? Consent must be obtained again before starting venipuncture. Always ask permission first to collect specimen verbally, okay? Now, there are times where the resident might not be able to speak, all right? So look for implied consent, all right? Usually a nod will, that would be considered implied consent, okay? If the resident extends their arm, that is implied consent, all right? So make sure that you get verification in some way or another. If you are not sure, okay, and you know, usually, especially for newcomers and they're being trained, so ask somebody else who's there, guys. Don't just go with, oh, well, I think this is it. Always get verification from another source if you are not sure what to do in situations like that, okay? What information do you review and clarify on a requisition form? So these are several things you must know, guys. The patient's first and last name and middle initial, patient's MR number, which is medical record number, patient's date of birth or age, the type of test you are there to collect, the date test that it is to be performed, and that is extremely important, guys. You might see that resident and collect from that resident, you know, every so often. Make sure you are collecting on the date specified in the requisition form, okay? You don't want to collect on a date you're not supposed to or a time you are not supposed to. Remember, some of these tubes are time sensitive, okay? So you have to be careful that you collect these tubes at the indicated date and time it is being asked for, okay? There will be a list of the type of tests, again, that you are there to collect. The billing information, which will also indicate the ICD codes, the test status, whether it is a test that is timed, whether it's a fasting test, and usually that falls under, you know, stuff like glucose, okay, which deals with diabetes, all right? Usually when you are collecting from a diabetic patient or you are there to take a glucose test, there is a specific time and there are specific requisitions that they require, which is fasting, all right? And I believe that is another question that came on the final exam when it dealt with water, okay? You cannot completely dehydrate a patient, okay, or a resident. So, you know, some of these sensitive collections do require maybe just a tad bit of eating or water beforehand, all right? So make sure, guys, you look at the requisition form, and if you have any questions, anything at all, you get informed with the doctor as soon as possible. Let's say, for instance, a resident who's supposed to have a glucose test comes in, it's 8 o'clock in the morning, and they tell you, well, I had a light breakfast this morning, okay? And you're not sure whether to collect or not because it's a fasting, all right? Call the doctor, see if the doctor still requires you to continue to perform on it or not, all right? So if you're not sure, please get in touch with the doctor to find out, all right? The special precautions and the room number. Now, when you approach a resident, guys, you need to make sure that you also ask the appropriate questions, all right? Do they have reactions, you know, to needles? Are they afraid of needles? Do they tend to faint you know, when needles are used for them? And you need to take precautions when it comes to those special patients, okay? Make sure they are in a bed lying down if they tend to faint when blood is removed. Make sure that they don't have any type of, if they're not prone for seizures, okay? If you have a patient who tends to get seizures a lot, take the proper precautions. Aside from that, guys, you know, watching yourself as well. So if ever an occasion arises where a resident is reacting, you know, what we call syncope, another word for a medical term for fainting, make sure that You guide them to the floor, guys, if possible, or against the wall. Loosen up any clothing that they might have so that way there's, breathable air. Bring their knees to their feet if they're against the wall. Let that blood flow just continue normally, all right? Stop whatever you're doing. Do not continue. Just completely remove all material as fast as you can by, of course, not injuring yourself in the process. But always put the patient, guys. Make sure that you tend to the patient as soon as possible, okay? How do you verify compliance with testing requirements, and what do you do when a patient's not compliant, all right? You must always determine that the patient understands what is about to happen and obtain permission before proceeding, which means informed consent. Have another person that is trained or better skilled to perform the venipuncture if you don't feel comfortable in the process. If the patient is insistent, there is nobody around. Guys, ask them in a very nice way. Well, why is it that you don't want to? And tell them the importance of, why they are there. I'm sure they know why they're there. That's why they're there. The doctor sent them, and tell them how important it is. A lot of these patients get, blood taken out of them constantly. All right. And they're not comfortable. Who is comfortable with needles? So go around it, guys. Talk to them, calm them down. Maybe within a few minutes, they will feel different about you, getting their blood, and they'll allow it. So don't just go with the first no, although yes, we are supposed to respect their decision, and that's the main thing, but go around it, see if you can encourage them to change their minds, all right? If they faint, guys, or they have a reaction, have the patient lie down and apply an ice pack to the site 10 to 15 minutes to numb before venipuncture. Okay, that's extremely important. All right. This will help, and this applies to adults and even babies, all right, or infants. So apply that ice pack, all right, to numb that area so that way it is not, it doesn't hurt that much, all right, or sting that much. Timing requirements for draws. Typically, usually after the last meal of the day or after midnight. And this is focusing on fasting, guys. I believe this was another question that came out on the exam. Fasting is usually 8 to 12 hours, okay? And that's what we call basal state, okay? I just don't remember how it was asked, but it did come out. So please make sure you remember that. Fasting is from 8 to 12 hours. If they throw a question at you like that and they say, well, after midnight and stuff like that, that is what the test is going to throw at you. As long as you remember basic information, you should be able to answer it. So remember, fasting is 8 to 12 hours, and it is called basal state. Water is important so patient does not dehydrate. Usually, guys, if you have a dehydrated patient going in, it will affect test results. So water is okay. Water is fine. It's no problem. It's when they come across, other things like coffee or anything containing sugar or, Coke or tea or even a meal, okay? What are variables which might impact your collections? And usually, guys, another one that might impact collections is the basal state, all right? If they're not fasting, it will impact the results, okay? So make sure that it is within the 8 to 12 hours, all right? Cortisol is also a very important word, guys. Again, it's cortisol. Usually that is higher in the morning and after drinking coffee or caffeine, okay? High protein diets are also high. HGB is pretty low, drinking too much water, and lipid levels are high after eating foods, okay? Again, cortisol is high in the morning. after drinking coffee. High protein diets is high, which is ammonia and uric acid. HGB is low when you are drinking too much water, and lipid levels are high after eating foods. All right. How do you position the patient to optimize comfort and safety and specimen collection? If you want to look on page 221, it is right there, guys. So please write that number down, 221. Sit patient in a sturdy chair with armrests and make sure the back is aligned well and straight, preferably at a 90-degree angle. And the hand must be well supported. So try, if the resident is in a wheelchair, try not to rely too much on that. Put the patient in the appropriate chair, all right? That would be best. That's why the equipment is provided, so make sure that they have it available, all right? What are some examples of non-blood specimen collection procedures? This is found on page 402 to 418, guys. Again, this is found on page 402 to 418, okay? Urine is an example of one. Label on the container UA, whether it is a midstream collection, whether it's clear, dry, and chemically container must be fitted tight, all right? The CNS container must be sterile, and urine must be processed within 2 hours if left at room temperature with no light on. So make sure, guys, that, you know, when it comes to urine, that you label it correctly. It will usually be in a sterile container, usually what they call clear, you know, cloudy white container. Make sure that when you collect it, that you don't clean it. Just close it, make sure it's sealed tight, make sure you label it with the patient's name, date of birth, possibly room number or MR number, and make sure you put it in the bag that you need to put it into, all right? And make sure you deliver it to the appropriate people within the specified time, okay? Verbal instruction must be accompanied by written instructions, preferably with illustrations. And this is usually done, guys, at the beginning. So make sure that you take care of that. Urine, guys, they use it. Usually the hormone that is found in urine is called HCG. And that is a hormone present 10 days after conception. Please remember that came out on the exam. They use urine for pregnancy tests, and usually the preferred method to do this is early in the morning. The first morning specimen is best. All right, now semen, which is found on page 411. Specimen should be collected in a sterile or chemically clean container. It must be kept warm, protected from light, and delivered to lab immediately. No condoms should be used on this, and it contains spermicides. So that is why we don't use condoms, because it contains spermicides. Sputum is found on page 412 of your book. Usually much like the urine, it is preferred to get it early in the morning, right before they even have breakfast or their cup of coffee. If not, all right, let's say it is your shift and you go in later, that is fine. Collect the specimen 1 hour after the meal. Make sure that you remove dentures and rinse mouth with water, okay? 3 to 4 deep breaths. Make sure you take 3 to 4 deep breaths, inhaling and exhaling. Then forcibly cough up at least something from there, okay? Have them make a deep coughs so that way you can get the best that is stuck in there, guys, for the morning collection, all right? Turnaround time, what we call TAT, T-A-T, That deals with what is ordered, what is collected, what is transported, what is processed, analyzed, and reported. Okay. You must know the difference between, and I'm focusing on these three guys because this did come out on the final exam. I'm not sure which one. You need to know what ammonia is, what bilirubin is, and what cold agglutins are, okay? Ammonia deals with lactic acid and is usually a slurry ice. Bilirubin needs protection from light. And usually you will use the amber tube or you will use foil to cover the tube when transporting. Okay. And cold agglutins must be at body temperature. Okay, so please remember those guys. They do come out on your book. Let me see if I can find the page number real quick. Also, guys, another thing you have to remember now that we're there is page 317, the procedures of a newborn. That is extremely important. So please learn that for your references and review that. All right, guys, what I was just discussing about bilirubin, bilirubin, ammonium, and cold agglutins, that is found on page 389. It is on table 12-2. And those are the three that you basically need to know. So make sure that you all understand that before you even take the exam. Again, that's found on page 389. Right. Make sure that now that you're there on page 388, where it says hematology specimens, I believe there are 4 bullets there. They're talking about blood smears. Please learn that. All right, learn those 4 bullets on those 2 pages right there. Allocating, guys, you need to know its definition word. It could be used in a sentence. It will not be an answer. It will probably be used in a sentence. So if you don't know its meaning, it's going to be hard to answer questions. And that is one thing when it comes to the phlebotomy exam. When it comes to definitions, if you just pass through it, not learning the meaning, I'm going to advise you highly to review your definitions because the questions are stated in medical term format, all right? It will use your definitions within the questions. So if you don't understand the meaning of that word, you're not going to be able to answer it correctly unless you're a good guesser. So please refer to your definitions when it comes to studying as well. Okay, and allocating, guys, this is done right after centrifugation. Make sure that you divide the specimen into smaller portions. All right. Biohazard bag, that's extremely important. It must be labeled before placing in the biohazard bag. And usually the biohazard bag, guys, it has that symbol, that red or dark orange symbol. And in the back, there's like a little pouch where you can put paperwork and stuff. Make sure you label it correctly. The label must include the patient's full name, the date it was collected, the time of the specimen collection, and the source of specimen. Remember those 4s. Again, the label must include full name, date, time of specimen collection, and source of specimen. All right. Urine specimen, I'm going back to it, guys. It does need refrigeration. If you know that it won't be tested immediately, you can place it in the refrigerator, okay? And make sure that all blood tests remain upright to prevent agitation or clotting, okay? Hemolysis, guys, that's another word that you need to understand. It's when you shake the tube vigorously. Each tube must be inverted a certain number, okay? And that is found at the back of the book. I had mentioned it earlier. It is found on page 463, and it'll tell you the inversions, all right? If you do it more than the inversions, it could affect the test results. If you shake it too hard or too long, it will affect the test results, all right? But the appropriate word is hemolysis for that. So please learn that definition word. Moving on, guys. All right, white blood count, guys. Please note this somewhere. I believe I saw these next two things that I'm going to talk about in the final exam. When you deal with WBC or RBC, guys, for the white blood count, it must be normal between 4.5 to 11 millimeters. All right. Normal glucose should fall within 70 to 110. And the body temperature must be at 98.6 degrees Fahrenheit. The appropriate number for hemoglobin is 12.5. I believe one of those guys did come out on the final, so just memorize those numbers. Okay, white blood count.
Sorry to interrupt you once again. What's the page number?
For the inversions?
The glucose levels?
Oh, the glucose levels? No, that was my information. That's not in the book. That came out of me. So a lot of this information, guys, I found on my own. And that was one of them. So the normal glucose is between 70 to 110. Okay, hemoglobin is at a number of 12.5. Okay, and if you Google it, it will, you can even look up the hemoglobin specifically for men and for women. It will give it to you. But when I came across this, just the basic number was fine. Okay, you don't really need to know specifics when it comes to gender. Okay. Except that, you know, when you're collecting, you know, blood specimens and stuff like that, of course, right? When it comes to, you know, semen and urine, of course, that is different. But when it comes to this hemoglobin, glucose, you just basically need to know the basics, okay? So white blood count is 4.5 to 11. Normal glucose is considered 70 to 110, and hemoglobin is 12.5. Okay. Know the difference between anticoagulants, guys. They do not need to wait. They can be immediately centrifuged, okay? You don't know what centrifuging it is. Basically, it is that machine that you put the tube in and it turns it around and it mixes up everything, all right? So anticoagulants don't need to wait, all right? Plasma and serum, they do need to wait for at least 30 to 60 minutes to centrifuge at room temperature. Another thing that you all must remember is that when you centrifuge, most of the tubes should be at the same height. And if you are not filling it, make sure it is balanced. It's just like a washing machine, okay? That's the way I kind of memorized it. If you're gonna pack everything to one side of the washer, okay, you know, it's gonna start turning and it's gonna start banging because the weight is not even. Same thing with centrifuging, okay? When you put all those tubes in the machine itself to be centrifuged and it's not balanced, it's gonna start banging, it's gonna break all those tubes. So make sure that you put it at points where it can be even balanced, all right, before you even start centrifuging, okay? Going on, guys. Okay, this is something I memorized on my own. And I found this on the internet, okay? But there are two ways I want you to memorize this. And I believe this came out on the final, on the state exam, sorry. So please write this down, okay? When it comes to dermal samples. Now, dermal samples is different from what you know of collecting, you know, of the order of draw, which is found, the order of draw, guys, for those of you who joined in, it's page 203. That is the basic order of draw. Okay. Now, dermal samples are a little bit different. Okay. The order of draw is different. All right. So you need to know the two different draws and the difference between them. Okay. But I'm going to give you two types of dermal examples. Okay. And the first one, I want you to number it 1 through 6 on your notebook. And I want you to put L for number 1, G for number 2, LT for number 3, G for number 4, Y for number 5, and R for number 6. Okay. And the order of the dermal samples is number 1 is lavender, number 2 is green, number 3 is light green, number 4 is gray, number 5 is yellow, and number 6 is red. All right. There is another way to memorize this, guys, and I'm extremely encouraging you all to learn both ways, okay? In class, this is what we learned in class. I'm sure you did too. I call it the BEOS, okay? So the B stands for blood culture. The E stands for EDTA, which deals with the lavender and pink tube. The O stands for other specimens, which focuses on the green color of tubes. And the S stands for serums. Okay, so when it comes to dermal collecting, guys, when it comes to dermal samples, please remember those two orders. The first one I gave you is more exact. It basically details you exactly what tube color you have. The other one, it does work as well, but you need to know what blood culture tubes are. You need to know what EDTA is, you know, what color are the EDTAs. So this is where I'm saying that the first one is more beneficial to you, but learn both. It really wouldn't hurt you. And remember, guys, this order is different from the order of draw on page 203. Okay, they're two different things. So when you get questions, ask this on the state exam, make sure that they are talking about the correct draw, okay? And it will give you choices. So my advice to you guys, I kid you not, I think I used maybe about 4 or 5 sheets of paper that I asked for, and I just wrote everything down. Everything I remembered, everything that came to my head, I wrote down because it served later down the line answering future questions. So I didn't waste a lot of time there. All right. Sharp containers, guys, that's on page 184. So if you want to switch over there real quick, when it comes to sharp containers, replace sharp containers when it is 2/3 full. On the exam, I'm not sure if it gave it to us as a fraction or a decimal point. They could throw that stuff at you, and this is what I'm talking about when it comes to answering these questions. Don't basically rely on the way you learned it in class when it comes to numbers. No decimal points, no fractions, know the whole wording, because it will throw little surprises at you like that. So make sure that you remember that 2/3 full, or you remember the decimal point. Okay. Antiseptics, guys. There are several antiseptics we use. One of them is 70% isopropyl alcohol. The other one is 70% ethyl alcohol. The third one is chlorhexide gluconate. That word did come out, okay? I just don't remember if it was stated as a definition or it was within the sentence. So know that word. And benzalonium chloride, that is used for drug tests. I believe that came out also on the state exam. So know the difference between both of those. Chlorhexide gluconate and benzalonium chloride. Know the difference between those two, okay? Major one that came out was another word, the medical term for bleach. That is found on page 183. It is called sodium hypochlorite. So when it comes to chlorhexidine, gluconate, and sodium hypochlorite, they kind of look the same and sound the same. So, but please learn the difference. The way I remembered it, guys, bleach in Spanish is cloro. So if you look at the last word, hypochlorite, okay, that could help you answer it. All right, so that's the way I remembered stuff. All right, it should be diluted 1:10 ratio. And this deals with blood spills, okay? Allow 10 minutes of contact time to be completely effective, all right? Page 182, guys, always use latex gloves. If you happen to be allergic, use nitrile, neoprene, polyethylene, or vinyl, okay? Paper card, guys, page 315. It did ask questions about newborns, and I'm not specifically sure exactly how it was stated, but it did talk about it. I believe I mentioned to you guys. Start on page when it comes to blood collection for a newborn. All right, also, before I go on, guys, look at page 302. Figure 10-10, that was another question that came out. When you collect blood from an infant heel, you must not know it's where it's collected. Of course, you were supposed to learn that already, but it's the wording that they use, okay? The plantar surface where the pinky is called lateral, and then the plantar surface at the heel right in alignment with the toe is called medial. So you need to know the location for the heel of a infant, all right? Page 315, guys, I mentioned I reviewed through all those pages. If you're not sure, starting from page 305 and on, but I want to focus on page 315. Filter paper card is used to screen a newborn. Apply blood to the printed side of the filter paper. Only one large drop should spread throughout the circle. So let's say this is the card, okay? One drop should be enough to where you turn it over and you can see it on both sides. Don't put a drop of blood here and then turn it over and another drop, okay? Just one drop is sufficient, okay? And please refer to page 315. There's a lot of information in that page, guys. So if you're still not sure about some stuff, go back to that and focus on page 315. Right. All right, know how to put on gloves, guys, and of course, how to put on and take off a gown and the order of it. So I'm gonna give you the order of how you put on the PPE and the order how you take it off. This was one of the questions that did come out when I took the exam. I also want to keep you all in mind when I'm stating that I saw this, you know, when I took the state exam, it doesn't mean that you're going to get the same state exam as I did. All right, there are some questions that are going to be different, but they do tend to cater around the same material. The material won't change, the question will change in the manner that they are asking about it. But the stuff you learned, it's going to be the same thing. It's just going to ask you in a different way. Okay, so feel comfortable with that. All right. How you put on and how you put on a gown. Okay. First, okay. I'm sorry. How you put on is first you're going to put the gown on. Then you're going to put the N95 mask on. Then you're going to put the goggles or the face mask. And then you're going to put on the gloves. The gloves should be the last thing you put on. And this is for all PPE. All right, so when you put on, first thing that comes first is the gown. Make sure that you tie it in the back, right? Then comes the mask, the N95 mask, then the goggles or face mask, and then the gloves. All right, and when you take off this stuff, it's a different order. You're gonna take off the gloves first. You're gonna then remove the goggles and the face mask. You're gonna then remove the gown. All right, and then the mask, the blue one that we have will be the last thing you remove. So first it's gloves, then it's goggles or the face shield. I call it the face mask also, but face shield if you want to. Then it's the gown, and then it's the blue mask that we all have been using for COVID. That's the last thing that goes off. Okay. The HPV shot, and let me go back to OSHA, guys. OSHA was a big thing in this chapter, all right, and in this book. So OSHA basically gives us guidelines to use safety devices for our safety, and that is found on page 75. And that comes with all the PPE and everything that we use, guys, all right? Another thing that should be given to us is called the HPV vaccination, okay? And this not only for ourselves, but everyone else. Now, there is a certain way on how the collection of HPV works, okay? And there's 3 doses, okay? The first dose will be, let's say, it will be given today with the date of November 10th, 2020. Let's say I go in for my first dose today, okay? My second dose will be a month later. So on December 10th, 2020, I will get my second dose. And my third and last dose will be 6 months later from my first. So if I got it today, on November 10th, you count 6 months. Okay, November, December, January, February, March, April, and May. I will get it on May 10th of the coming year of 2021. Okay, so the first dose is that day. The second dose is a month later. And third dose is 6 months later, which is half a year. Okay. And it always starts with the first dose, guys, the initial first take. Okay. Blood, bone pathogens to prevent exposure. Make sure you have the appropriate PPE and you receive the special training. Make sure you wash your hands with soap and water, okay, for at least 30 seconds. If you have something that was, splattered into your eyes, all right, wash at least a minimum of 10 minutes. And if you were exposed to chemical exposure, make sure that you cleanse it for at least 15 minutes, and you must report it immediately to the supervisor. All right, know the preventions of fire. For those of you who are taking phlebotomy, I'm sure this is just review for you from CNA because this came out in CNA class. Know what PASS is and know what RACE is. All right, P stands for pull pin, A stands for aim, S stands for squeeze, and the last S stands for sweep side to side. And RACE stands for, R stands for rescue, A stands for activate alarm, C to confine, and E to evacuate. And know the types of extinguishers out there. There are several, guys. On page 87, let me look real quick. All right, there are 1, 2, 3, 4, 5 different categories. Okay, you've got category A, B, C, D, and K. Know the difference between those 5. All right, you really don't need to learn its icon, but its intended use. All right, so it is right there for you on page 87. So know that, as well as what PASS and RACE are. Okay. Radiation safety, that is found on page 88. Make sure that you have enough distance, you have enough shielding, and the amount of time you are there. All right, so whenever you are exposed to radiation, make sure you follow those three things: distance, shielding, and time. Okay. The safety data sheet, what I call the SDS, is basically a binder on the right to know things. All right. Know what it is and where it is located in the facility. It's basically a binder that has sheets that has every hazardous chemical that they use on or within the grounds of that facility. All right. And it is usually contained in one area and it is in a binder. So when you get hired, I'm sure that's going to be one of the things that they show you firsthand is where it's located and what is included. So make sure that you know all that before you even start working there, guys. Ask all those appropriate questions. There's nothing wrong with asking. All right. First aid, that is found, I believe, on page 93. Hemorrhaging, the thing about one thing we learned on CNA is that you must constantly apply pressure when you have an excessive amount of blood coming out. So you will possibly have patients who are excessive bleeders. You know, just maintain that you apply enough pressure, you apply enough gauze to the wound, apply pressure at least 3 to 5 minutes. And they could also, one situation that you are experiencing that is because they take blood thinners. So one of the questions you should ask is if they take blood thinning medication. And if they do, expect stuff like that to happen, but make sure that you just apply pressure 3 to 5 minutes. If it does not go away, then get help. Okay. Shock and body, guys, when it deals with shock and body, organs will shut down. The skin will become pale. The eyes will be kind of starry and gazy, and it will become cold. Always stay with the victim. Never leave them alone. And call for help and maintain open airway. Head must be down, legs must be elevated, and keep the victim warm to bring circulation back. All right. Know the basics of CPR. How many compressions? All right. So there's for an adult, it should be 30 compressions, and for those 30 compressions, 2 respirations. Okay. Know the difference between the isolation procedures, guys, found on page 72. All right, let me just review that real quick. There are several, one of them is airborne precaution. The other one is droplet precaution, standard precaution, and contact precautions. You must know the exact PPE to use for all of these precautions. So please review that as you go in further. Know what the Joint Commission is. Basically, the Joint Commission sets standards in hospitals in every department. Think of it as the FBI, I guess, okay, the Joint Commission. They basically see everything, okay? It is not just the phlebotomy section, it is basically the whole hospital, okay? They may visit a facility and they will send their own people to make sure everything is running correctly the way it should, okay? Now, CLIA 88 is a little bit different. This gives guidelines for the laboratory only, okay? It is not like the Joint Commission, all right? The Joint Commission deals with the whole hospital. CLIA 88 basically gives guidelines for laboratory, okay? And also the proper training that phlebotomists must go to, okay? Then we call the next one HIPAA, which was developed in 1996. This minimizes the risk of patient information, sharing that information, and it should only be shared with people who are taking care of them. So this is why I talked at the beginning of keeping all that info. If it's a file or manila folder, please don't leave it around where maybe, you know, people who are visiting the patient can get it and see it. Make sure it is in your hands at all time. If it is a computer screen, make sure that computer screen is only visible to you and nobody around you. All right. Make sure about the manufacturing equipment, look out, and this is all equipment, guys, equipment you use daily for these patients, okay? Whether they're glucose tests or, anything you might use on a daily basis with them, make sure that you get it checked, make sure that it is clean, make sure that you follow the expiration dates, make sure it is working before you even start using it. You don't know how to use it, follow the instruction manual, it will tell you. And of course, maintain maintenance log. So that is, when did you clean it? When did you check it? Was it running efficiently? Did you send it to be repaired? What date did you send it to be repaired? Stuff like that, keep a log of everything, all right? It is your equipment, you are responsible for it. Okay, so make sure that you always, I don't want to say this, but make sure you cover your own back when it comes to equipment. Basically, the results that come out, you're responsible for it. So make sure that all equipment is kept up and maintained well, all right? The CLIA waived, that is a procedure that has very minimal risk for errors. An example of this is a pregnancy test, okay? It's either a yes or a no, okay? Electrolytes are a little bit more complicated and they are at higher risk, okay? Going back to the biohazard symbol, guys, on page 104, make sure that it is 2/3 full, that there is only one door that is able to get access to it, and that is it. And it must be locked at all times, all right? There are several other things, guys, and I want you to write this down. It came out on the final exam, I just don't remember which one. I took it upon myself to write them down, and I'm glad I did because it did help me, okay? And this is dealing with precautions, whether it's droplet, airborne, or contact, okay? And these are things, diseases, etc., that you need to be careful with when you are working in a clinic, when you are working in a hospital, or when you come in contact with patients, which you will be. So you need to be very aware if they have this certain illness or disease that you wear the proper PPE. Okay? And that's where, knowing what to wear comes into play. Okay. So when a person or a patient has shingles, they should use the droplet precaution when it comes to that. For TB or tuberculosis, it is considered airborne. So make sure to wear the proper PPE for airborne, okay? Scabs, that is contact. Diarrhea, that is also contact. And I believe it's, one of the chapters goes more into detail about that. Meningitis is droplet, and varicella is airborne and contact. So please know those 6 that I mentioned, guys, what each one you need to be careful with, okay? All right, guys, when you are explaining the time requirement, it will indicate it in the acquisition or requisition form, okay? That is found on page 214 of your chapter. Time and requirement has 4 different ones. You need to know these for your final. It did come out. One of them is stats, STAT''S. And I am putting them in order, guys. So please write these down. The first one is stats. The second one is ER, which means emergency. The third one is timed. And the fourth one is routine. Now, there will be times, especially if you're working in a hospital, some collections will be, considered very time sensitive. So if you're ever stuck in a situation where you have a resident who needs a collection within a timed hour, but yet they're calling you to the ER, you know, that they need a collection of, I don't know, Billy Rubin or something, you know, stat. Stat means right away. So what decision do you go with? Do you stick with the timed or do you go to stats? Of course you go to stats. That's why I gave them to you in order. The first one should always be stats. That comes first before anything else. You drop basically everything else and you deal with that. The next one in line is ER, emergency room. The third is timed, and the fourth one is routine. So when you are collecting, make sure to follow that 4-step system. All right. What does it mean to position patient? Make sure that the arm is in a downward position. When we were taking this class, phlebotomy, and we had the great privilege of coming in person and trying the procedure and process on each other, which was a great learning experience. The arm was always never, you know, above the shoulder. It was always downward in a downward position. So that way gravity helps with the blood flow. Okay, so make sure that the arm is in a downward position. Look at the veins, guys. The first one that you should always look at is the median vein, which is the one right in the middle. Then the second one of choice is the lateral vein, which is the cephalic vein. All right. Another thing you can do if you're not certain what arm to pick, ask the patient, you know, where is it that they usually collect from? They'll be honest with you and tell you, because they, of course, you know, they don't want to be there as well. So they'll probably tell you, you know what, collect from this arm. People get blood more on this arm or this vein, or, you know, they will help you in the process. So there is nothing wrong with asking them, do you prefer a certain arm, or where do they collect more from you? There's nothing wrong with that. Always ask the patient or the resident, guys, which arm they prefer. All right. Things to no, well, look at page 406, guys, and 407. I want you to focus on that chain of custody. All right. And that deals with pregnancy test, which is the HCG. Okay. It's a 24-hour urine test. And make sure that whatever you collected, guys, that you turn it in right away, or that you put it in an area where there is no light, or in the refrigerator if you are sure that it will not be tested as soon as you collect it. Okay. Know the difference between, not the difference, guys, but the peak and trough levels. This also did come out on the state exam. All right. It should, for peak and trough levels, if it is, the medication is taken orally, you should wait 2 hours after the drug is taken to collect any blood. If it is done through an IV, administered medication to an IV, you must wait from 15 to 30 minutes after the injection to collect a blood sample. And if it is injected through the muscle, okay, which is right here, guys, our arm right here on both sides, right here or right here, you must wait an hour after the drug is taken. So please know those three. Orally is 2 hours after drug is taken. IV is 15 to 30 minutes after drug injection, and muscle is 1 hour after drug is taken. Okay. Assist with specimen collection. You might assist with bone marrow collection. Make sure that you label it and you handle them accordingly. If it needs to be chilled, you chill it. If it needs to be protected from light, Make sure that you either have the amber tube or you cover it with foil, and make sure it is at room temperature. Okay. Chapter 10, page 315, guys, that deals with blood spot collection, going back to the baby. Make sure that it goes through both sides and put it on a level surface, okay? That is what we call the PKU test. Know what it stands for, guys. PKU test. All right. When you are doing a collection, of course, you're supposed to wipe off the first drop of blood. So make sure you do that. It is a heel puncture. If it is a heel puncture, make sure you do it on a child less than 1 year. And if it's a capillary puncture, it can be over 1 year old of a child. So know the difference between heel puncture and capillary puncture. Heel puncture is less than 1 year old. Capillary puncture can be done when the child is 1 year old or over. All right. How do you remove a venipuncture device? Basically, the way you put it in is the way it should be removed, at the same angle as you put it in. Angle insertion for the needle and withdrawal should be at least by 30 degrees or less. All right, so make sure you are careful with that. Make sure, guys, on the inversions, it talks a lot about that when it came to the the state exam. Light blue is 3 to 4 inversions, and the others are 5 to 10. Now, one thing I will tell you on the state exam, is that it wasn't that basic, okay? It just didn't offer you the opportunity, okay, well, let's say light blue, how many inversions is light blue? And it gives you a choice, 1 to 2, 2 to 3, 3 to 4, 5 to 6. It's not that easy. All right, I believe on the state exam, it did ask for inversions, but it asked for a specific number. And if I'm not mistaken, I think it targeted the inversions for 8 or for 10. So when I said that you have to basically memorize each tube with each, how many inversions for that tube, you basically have to memorize it. It won't be that easy on the state exam. All right. So refer back to your book, guys, memorize those inversions. Most of them are the same anyway, except for the difference of 1 or 2, but do memorize the inversions for each color tube, okay? Know that syncope deals with fainting. That's a definition that's gonna come out in a question. Not that you're not gonna answer it, but that word will be in the question. So if you don't know what syncope means, which is fainting, you're not going to know how to answer the question. And I believe that was one of the problems that people who took the state exam found it very difficult, not because they didn't know the material, because they were very familiar with the material. It was just the definitions and the vocabulary that was used when it was asking you a question. You don't know the definitions, you don't know the medical terms or what it means, you're going to have a hard time answering these questions. So please go back to your definitions and just read over it and go back and learn it. All right. For those of you who need to know this, I did write on my book, as well as cards that I created, on the number of inversions. So if you all want to write this, it will help you. The first order of draw, guys, is what we call blood cultures, okay? And that can come in the form of the bottles or the tube, okay? That can be from 8 to 10 inversions. Light blue, the color tube for light blue is the additive is sodium citrate, and that deals with 3 to 4 inversions. The red is a clot activator, and that has 4 to 5 inversions. The gold, which I call the SST, it is a serum separator tube. That's another thing. You must know what serums are and which ones are located in what tubes. So please go back and refer to that. That is 4 to 5 inversions. Light green is the additive is lithium heparin, and it has 8 to 10 inversions. The next one is green, and that's sodium heparin. That has 8 to 10 inversions. The next one is lavender. The additive is EDTA, and that has 8 to 10 inversions. And the gray, which has sodium fluoride or potassium oxalate, that has 8 to 10 inversions. Okay, so memorize those for your final, guys. It will sneak up on you. So please learn those really well before you even come and take the exam on Friday. Seizures and convulsions, always stop what you're doing when it comes to a seizure incident. And this is why these are the questions you ask. Before you even start taking blood and after they give you consent, ask them if they have a fear of needles, if they have experienced fainting, which is syncope, if if this is their first time, having blood withdrawn, which, it does happen, you don't know how the patient will react. So ask these questions, all right, before you even collect, okay? But if there happens to be a seizure and it falls in your time, make sure that you stop what you're doing. Make sure the resident is in a comfortable position wherever they might be. Make sure never to put any objects inside the patient's mouth. Make sure to have them lie on the lateral side, which is to the side, never in a prone, and try to avoid a supine position, facing up. Put them on a lateral side better, so that way they won't choke on their own saliva. Everything will just drip outside if they're in a lateral position. Make sure to document when it happened, how long it happened, the time they stopped having the seizure, and if they had more than one seizure. Make sure you document that if you ever are in the case that you have to help a resident with that, okay? Hematoma, that's another definition you must know, guys. Basically, that means that you punctured an artery and it can cause a lot of bleeding, okay? So make sure that if that happens, you document. When you hit a punctured nerve, all right, the patient will feel it as more like an electric shock, so they will warn you. So take every precaution when you do that, guys. Please, in a calm way, remove the needle and stop what you're doing, okay? Apply pressure if they're bleeding, and make sure that you document everything, okay? Redirect the needle, guys, when looking for a vein. Sometimes I know that when we practiced on each other, and I even practiced on myself, it's going to be hard to get the feeling of what is right or wrong. So usually when you hit the correct vein, all right, you will not have any problems with blood flowing out into the collection tube. You're automatically going to see it. Now, there will be times where it will stop. Okay, so try and redirect that needle, pull it out a bit, just don't pull it out of the skin. Because once that needle is exposed out of this, out of the vein and out of that skin, you have to start all over. You cannot go back and inject it again, all right? So make sure that needle stays within, but you kind of pull it out a little bit from where it's at and redirect it back in, all right? Now, remember, you are dealing with people who are feeling everything with this needle, so don't be, kind of squabbling and searching for it, because that does hurt, but do it in a soft manner where, if you don't find anything within a few seconds, 30 seconds of trying, or even a minute, just stop what you're doing, take out that needle and start all over, all right? Post-care, guys, questions to ask after you are done. Of course, you're supposed to apply, with a gauze pad or on pressure. while, the patient or the resident can apply pressure themselves where you are putting the collection tubes and labeling them with the patient's name, date of birth, and all that information and the date collected. So while you're doing all of your job, the patient is applying pressure at the same time. Now, while doing all this, guys, you need to ask, how do they feel? If they feel faint, if they feel dizzy, if they feel fine, okay? Make sure that you escort them all the way to the lobby, just in case they do feel a little bit woozy and they're not telling you the truth, okay? Make sure that you escort them, walk them to the door and to the lobby. Make sure they get to some place where someone can take care of them or they can actually sit down. Please don't let them leave the room by themselves. Make sure you have your eye on them, okay? If you are walking the resident and they begin to experience syncope, which is fainting, assist them to the floor, all right? Help use your ABCs, your alignment, your base of support, and your center of gravity. The ABCs are used for when you're doing any type of lifting or bringing down of some sort. Remember that your knees must be shoulder width apart, that you bend your knees not to strain your back, and you bring that resident or that patient to the floor slowly, okay? Have their knees put up to their chest, sit against the wall, or if a wheelchair is available, have them sit in a wheelchair. But basically, you must have them sit at a 90-degree angle, all right, to get that blood flowing, all right? Make sure that if you do sit them in a wheelchair, that you have their bodies straight and aligned and that you apply the brakes, all right? Make sure that they are not left alone. If you have somewhere to go, make sure that somebody is there to watch over them. Never leave a resident or a patient alone, all right? When it deals with bandages, guys, when you're done with collecting, you can apply a bandage to an adult after the blood has stopped, but to an infant, okay, do not apply bandages 2 years or younger. So refrain from applying bandages to children 2 years or younger. Choking, this is a big choking hazard or an inhalation hazard, okay? What is your role as a phlebotomist in the lab? Basically, a phlebotomist's role is to access the specimen in the lab, document the time of collection or the amount of quantity, all right? Whole blood specimen, when it deals with RBCs, which I call red blood cells, guys, basically it deals with a 45 to 50% of blood when it deals with red blood cells. Let me see what else. Veins, guys. Basically, there is a difference between veins and arteries. Know the difference between them too. Veins bring blood to the heart. Arteries take blood away from the heart. So know the difference right there. Veins bring blood to the heart. Arteries take blood away from the heart. Okay. Hemostasis is the being able to coagulate, which means stop bleeding or stoppage of bleeding. And there are several other questions, guys, that I wrote down. How does a black tube differ from light blue tubes? And basically, it's the ratio of blood of what is the difference between both. I want you to write this down. Again, how is black tube different from light blue tube? Basically, the ratio of blood for a black tube is 4:1. The ratio of a light blue tube is 9:1. The orders of tubes for a CVC draw are in order from 1 through 4. The first one is red to discard, then it's blood cultures, then it's anticoagulated, then you deal with clotted. Okay. The tube that binds calcium is the one that has EDTA. All right. The additives for a dark blue tube are sodium heparin, EDTA. The tube for testing for trace elements is the dark blue. The tube for nutrient analysis is also dark blue. And for toxicology reports, that is also dark blue. The tube used for testing blood alcohol levels, and they do this, guys, and when it comes to people who are stopped, where they take blood alcohol levels, you must make sure to collect these extremely well, guys, and documentation when it comes to collection. All right, and this you would use the gray tube. All right, be careful that when you are, if you are in charge of releasing these results or these tubes to somewhere else to be tested, make sure you get the name of that person you are releasing those tubes to, where they work, phone number, what is their position, and of course their name, and of course signature if possible, guys. Have them sign it, right? Make sure you cover your back in every way. And the tube used for glucose testing is also the gray. Tube used for medication checks, that is the red tube. Tube to test for electrolytes, that is the green. And tube used to check potassium, that is also the green. Which combination is used to test electrolytes? That's both the lithium and heparin. And molecular drug testing is the lavender tube. SST stands for serum separator tube. And tube tested for clotting is also the red tube. All right, so those are my notes, guys, that Mr. Reyes gave right before our final. I'm looking through everything else that I wrote beforehand. Know these three, guys. There's three types of fluid. One is called pleural fluid, the other one is called peritoneal fluid, and the other one is pericardial fluid. Pleural fluid deals directly with the lungs. Peritoneal fluid deals directly with the abdomen, and pericardial fluid deals directly with the heart. That already gave you guys on the body temperature, the cold agglutinin, the pneumonia, and the bilirubin. Already asked you to review to that. PKU testing, that was a big thing, guys, so make sure you study that stuff. Again, ensure blood circles are completely covered on both sides. Allow them to air dry in an elevated horizontal position. And make sure the circles are complete using a single drop. Make sure that you do not stack these cards or forms. It will be considered cross-contamination. When you're dealing with the baby's foot, always use the plantar lateral surface as your first choice. If you are doing a routine blood smear, make sure that it is covered enough, guys, in a feathered kind of motion. Capillary puncture is considered CBC, that is collected first. And the blood smear should cover, guys, within 50 to 75% and the feathered look. So make sure it is covered between 50 to 75%. One thing that I did, I wish I could mention it to you, but it's hard to explain, is that if you were to YouTube the basics blood smear cover, it will give you a visual representation of what it should look like and how it's done. I recommend it highly for you guys to look at that video and see how it's done. It did help me kind of understand it a little bit better when I took the state exam. Drugs that interfere with blood and urine tests should be stopped. If it is dealing with the blood, it should be stopped 4 to 24 hours before. And if it is a urine test, it should be stopped 48 to 72 hours. Know that the lipid levels basically means fat. That is very important, guys. Know the difference between hemoconcentration, hemolysis, and hemostasis. I know they kind of basically sound the same, but when you have a question based on this in your state exam, it's going to be of huge importance, okay? So if you're not familiar with these words, they are covered in chapter 9 of your book. Hemoconcentration basically means leaving a tourniquet over 1 minute, okay? When we are practicing, we tend to accidentally leave it a little bit longer. But when you are starting to work in an area where you're dealing with this, you cannot leave it more than 1 minute. So that word is called hemoconcentration, when you leave the tourniquet on for over a minute. Hemolysis is basically mixing a specimen too vigorously. And hemostasis is stopping of blood flow. So if you look carefully, guys, they're extremely different in each way. They might sound the same, they might even look the same, but their meaning is completely different. So please know the difference between those three. Basal state, again, guys, I'm putting a lot of importance to this. It is fasting 8 to 12 hours. Make sure that they can have water within those 8 to 12 hours of basal state, okay? Hemolysis, going back to hemolysis, mixing a specimen too vigorously. Shaken viscerally can wrongly elevate, especially the potassium levels, magnesium levels, and ammonia levels, okay? I talked about the fire, guys. Know the class A, B, C, D, and K. If you want me to break it down really simple for you, class A deals with electrical, class B deals with combustible, class C deals with flammable, class D deals with ordinary, and class K deals with cooking oils. Believe this question came out about scrubs. Your scrub should be at least 1 to 1.5 inches off the floor. They should not be dragging, okay? And also know what the right to know law is. Basically, it is an OSHA, standards. So everybody has the right to know, all right? CPR adult compressions, guys, know how deep to go for compressions. For an adult, it should be 2 inches. For an infant, it should be 1.5 inches. And children, it should be 2 inches. Know the HAI, healthcare associated infection. All right, and that comes with the HBV vaccination, or what I call the hepatitis B vaccination, the first, second, and third dose, guys. If an incident occurs with a needle, wash it with soap and water for 30 seconds. And if it's mucus, please flush the site for at least 10 minutes. Know the airborne droplet contact and standard precautions. When you are done collecting with any collection, guys, do not have the resident or the patient fold their arm. That is basically a big no-no when it comes to that. Have them have their arm extended and just apply pressure, but make sure that their arm is not folded in any way. All right. Capillary collection should be done on newborns or infants up to 12 months. All right, and please know the difference between the litigation process, guys. There are phases for the litigation process, okay? So there are 4. The first one is the alleged patient incident. Basically, the patient will be aware of possible injury. The second step after that, the person will consult an attorney. The third phase is the trial phase, and the fourth is appeals. Okay. Know what malpractice is. It's basically improper treatment. And assault and battery basically means not physically, you know, using your arm or your hand to hit somebody, but assault and battery falls under not getting consent. Okay, so you must make sure that you get consent of the patient and resident before you even think of prickering them with a needle. Okay, if you do not get consent, either verbal or nonverbal, that is considered assault and battery. Okay, so you must get consent before drawing blood. All right. Looking through each one, guys, know the difference between CLIA 88, CLSI, and the Joint Commission. All right. And that's about it, guys. So I hope that this review helped. I can't stress about the color tubes. Basically, that's a lot of the portion of this state exam deals with color tubes. So you must know the order of draw for the color tubes. You must know all the additives for the color tubes, and you must know the inversions for color tubes. Also, which ones are serum, which ones are not, which ones coagulate, which ones do not. All right. So I wish you all luck, and this will be the end of the review session for phlebotomy. Thank you.
Thank you.
Thank you.